Welcome back to the Injury Podcast. Today, we've got a great episode. We're going to be talking about something that is under the umbrella of regenerative medicine and how it can be helpful in people healing from injuries, when it's used most effective, and answer a lot of questions and concerns I've heard in my practice about it. I don't do actually PRP or stem cell injections. I do refer out to different physicians that do that. People are always asking, well, can it help me? Can it help me heal faster? So we're going to speak about this today. Today, I'm joined by two guests, and Dr. Patrick Tyrance, who is a orthopedic surgeon who does stem cell and PRP injections in his office. And also co-host today, Jen Nestler from Nestler Marketing, and she has a lot of experience in the injury sphere and ecosystem. So how's everybody doing today? Everybody doing okay on Friday today?
Doing great. Happy Friday.
Yeah, happy
Glad to be back.
Friday. Yes, yes. It's right here now. We're almost finished with April. It's when this airs, we're going to be, I think, in May. And we just had the NFL draft last night. Did you guys catch that?
A little bit.
I did not.
No.
Yeah,
It's
it
big surprises. but
You know what? I felt that it used to be more of a surprise. Now it seems like everybody knows what team they're going to play for. At least years ago, it seemed like it was a little bit more of a surprise. But it was great to see a lot of these kids get into the NFL. It's fun. Bring back any memories?
it seems a bit while ago, and I have some family members that had participated, had played. Cousin who is with one of the NFL franchises, and I do follow it, but I don't lose sleep over it.
Okay.
Oh, right.
Yeah.
Well, you were drafted by the Rams in the 90s, correct?
Yeah.
As a linebacker.
Yeah. Well, years ago.
Fun fact
Say the
Friday.
exact date, but yeah.
All right. So before we jump into the podcast, and we have a disclaimer, this podcast is for educational purposes only. It does not constitute medical advice, and it does not constitute a doctor-patient relationship. Always consult a healthcare provider before starting any treatment. So, all right, Doc. So for people out there that don't know let's start with PRP injections. What is PRP stand for? What is it?
You had mentioned earlier that what we're going to discuss, PRP, perhaps stem cells, is part of a larger group of therapies called regenerative therapies. And by definition, any type of regenerative therapy is a therapy that allows the tissues to, again, reclaim some level of activity and generate or heal. So PRP is an acronym for Platelet-Rich Plasma, and it has been around for, I'd almost say decades. I've been using it 12 to 15 years, and so it really is one of the earlier and most studied regenerative therapies. And we can talk further, but I can go on. But platelet-rich plasma, why has it been studied? Why does it have the track record that it does? Number one is from you, so it's an autogenic source versus allogenic, meaning we can use bone marrow, we can use your own fat, we can use your own blood. They have regenerative properties versus something that's allogenic. Oftentimes amniotic fluid, placental, umbilical cord tissues. So those are what we would describe as allogenic. And again, why platelets? Platelets think of them as first responders. So if you have a site of injury, they're one of the first cells that respond to an area of injury. And they help clot the blood. They release growth factors or signaling molecules that help to orchestrate healing in the area.
Okay.
Interesting.
Great.
Actually. And I wanted to ask you a question. How do you extract the PRP from the blood? And does it hurt to take the plasma out?
So the second question, whether or not it hurts, really depends on your individual pain tolerance. So despite me playing linebacker and being drafted, I mean, my pain tolerance is not that high. And better to give than to receive. So basically,
That's where you're on
Good one,
defense.
right, yeah.
That's where you're on defense to.
we know that the effectiveness of PRP really depends on how much blood you draw. Well, I should say how many growth factors you inject. That depends on how many platelets you draw, which depends on how much blood you draw. So needle, take a peripheral vein, usually from the front of the forearm and a cube, and typically 60 mLs of blood for what I would use it for: orthopedic, weight-bearing joint, maybe aesthetics, cosmetics. You don't need as much. I think a lot of clinics fail or don't get the results that you can achieve because you don't draw enough blood. We spin it, place in a centrifuge, red blood cells fall out, are discarded, and then you do a second spin. The platelets are concentrated in the bottom of the tube, and then you go ahead and inject that at the area of injury.
Okay, thank you, Doc.
Awesome. So, all right. I treat a lot of patients. I'm a chiropractor. I treat a lot of patients that have been in either sports injuries or car accidents. Somebody's in a car accident. The first, let's say, of this month. This month is April. We do chiropractic physical therapy type of treatment. When would somebody think about getting into getting PRP injections? Like what stage?
In part, it depends on the acuity of the injury, how severe the injury is, the level of trauma, the amount of energy that the tissues sustain. Most injuries will, if they're going to heal on their own, will typically heal generally within about 6 weeks. Platelet-rich plasma, if you use it before that period of time, can shorten that healing phase. If you're looking at PRP after 6 weeks, then the patient has established the fact that those tissues have lost their regenerative momentum, if you will, or ability to heal, and it needs a bit of a boost. In the setting of personal injury, again, typically after 6 weeks, if you're going to implement that technology, then some type of documentation of injury, whether it be ultrasound, typically an MRI of soft tissues, can give great information. And there's different signaling patterns that you'd see on an MRI.
Okay.
That would help facilitate that.
So as we're speaking about MRI, the
the
MRI
MRI
girl
girl,
right
right here.
right here. So if somebody has a sprain, strain type of an injury, or in the knee, or some inflammation, this type of technique might help to jumpstart or to facilitate the process of healing by kind of causing an inflammatory process, right? Slight inflammatory process, bring more blood flow to that area, help in the healing. And from what studies I've seen, it help not only with pain, but help with function. So it's not just a pain, like kind of an analgesic effect only. It can also help with the function. Now, I know that in my therapy that I do as a chiropractor, I work with patients, and sometimes we'll do the best adjustments. We'll do great exercises that are specifically for the injury they have. The patient's doing better, but then they go home and they lift improperly. They sit in front of a computer
Right.
for hours with poor posture. What's important, I guess, after they get the injection? What is your general directions you give to most patients so they heal better and it works better?
Right. So a few things. It's been said that sitting is the new smoking. Sitting for an extended period of times, it really wreaks havoc on your posture, your low back, tight hips, sarcopenia, muscle atrophy. So it really limits function. And as you said earlier, a main goal of this treatment is to resume function. I mean, that's why we're doing it. And I also emphasize that it's not magic. You know, it's something that it's not passive. You have to be actively involved. There has to be a level of expectation. And the platelet-rich plasma, again, has a number of growth factors. These are essentially signaling molecules. What also signals the body is the food that you eat, the thoughts that you think,
Oh, interesting.
loading the tissues. So it's not passive. So you have a PRP injection. It's not a time where you binge watch your favorite TV show and, you know, you share treats with your dog and get deconditioned, you know? I mean, so you really have to be active. To your point, it does cause an acute inflammatory response, which is healing, increased blood flow, and that is very different than a chronic inflammatory response. So no ice, no anti-inflammatories, no ibuprofen, maybe a little Tylenol, and you have to move. You have to load the joints because that too signals the tissues and facilitates healing.
Okay, so I just want to unpack this just a little bit, and if we can, just to summarize for people out there. So after somebody gets the injection, it's good to maybe relax for a little bit, not overload the joint. We don't want to do anything to like NSAIDs, right? Or
Correct.
nothing that affects the platelets, things like that. You would recommend heat, or most doctors would heat, because heat is gonna increase circulation. It's gonna put more blood flow to the area, maybe even help the patient get a better result.
Absolutely.
And then what about like activities, physical therapy, or walking, cycling, swimming? What kind of exercises do you think? Let's say for a knee, because that's common.
I try to identify what it is the patient enjoys doing and enjoys doing, and then have them do that, perhaps modify it.
Okay.
And if they enjoy, whether it be swimming, they're more inclined to do it. So one of the principles is it's not to eccentrically load the joint or the tissue, which is applying force as the tendon fibers are lengthening. And now you work out with the personal trainer, physical therapist, chiropractor. If you have supervised therapy, they're going to understand that. And so it's essentially, say if you like to bowl, it's allowing them to bowl by but putting the bumpers up and keeping them out of the gutter. So what is it that you like to do? Let's have you continue to do that with some level of precaution.
I am not allowed in a bowling alley
You're
because I need two gutters, two bumpers. I used to take the ball and like throw it down the lane because it was always hard for me to throw the ball.
Right.
And I've been like, I'm banned. My picture is up at the front. Don't allow this guy in there because he's going to break our
You
bowling
don't
alley.
use the assist like the dinosaur tail. And
They didn't have that when I was younger.
Okay.
You know, I'm a Gen Xer. They didn't
You
have
are.
that.
Right.
They didn't have that. So, all right. So, in terms, somebody gets a PRP injection today. How long typically before they could resume normal activity? Let's say I'm not talking they're an NFL football
Right.
player.
Yeah.
Okay, we're not talking about that.
Right.
We're just talking about the regular person that is maybe in their 30s, 40, 50s, 60s, that can get back to their same routine.
Again, it is a regenerative process, and you're looking at weeks to months. So I can say as early as 2 weeks, as early as 2 months, as long as 6 months, really depending upon what that level of activity is. And so it does require some patience. This is a long-term play, and again, you have to be focused, you have to be involved, you have to be intentional, on the outcome that you want, and not be passive. We want things quick. We want a shortcut. We want a hack.
Instant
you know.
gratification.
Yeah, this is not it.
Okay. Healing is a process, right?
Correct.
It's not a single quick event. All right. So we have a knee over here, right?
yeah.
That's not real, right?
No.
No, it's a real model.
Okay, that's right. Awesome. So you 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 brought the model here, and we also have a shoulder one too. Um, where would you do the injection in the joint or in the tendon or both?
Yeah. So it really depends on the pathology, and in general, platelet-rich plasma is effective in early injuries or mild to moderate severity. Oftentimes, say mild arthritis, a little bit of softening, a little bit of wear of the cartilage, a partial tendon injury. PRP is very effective. A full thickness tendon injury, end stage arthritis, not so much. There's some other things that we can do to augment that. But again, this being the model, femur, your thigh bone, quad tendon, kneecap, oftentimes the injection is given either, I'm sorry, this is the medial side, more towards the middle. Here, front anteromedial, anterolateral. If the patient is supine, laying on their back, then the injection is oftentimes here, and there's a space, small fat pad on the front of the femur, back of the quad, and we would inject in that space. So there's multiple ways to get the medication in the knee joint.
Okay.
I tell folks it really doesn't matter. I just need to get it in the joint.
Okay. So, and I guess what you were talking before, MRI is helpful in understanding what tissue is damaged, what tissue is injured, to be able to have more precision and better outcome. An X-ray alone probably wouldn't be is beneficial. So having that additional imaging. What about like ultrasound or anything like that? Sometimes do people use that too?
Yeah, I will use ultrasound in the office during the injection itself. MRI is a lot more specific.
Detailed.
Yeah, a lot more detailed. And one of the advantages of an ultrasound is that although there's less detail, you can move a joint and it is dynamic and you can stress it. With an MRI, it will show, we call the amount of signal in tissue, how it lights up and shows inflammation. So guide the needle, make sure it's getting into the exact area.
Okay.
Also, actually, I wanted to ask a question. Curious. So we're mentioning the knee and shoulder, but would PRP be like a good effective use to inject in the spine? Like there's a spinal injury and the patient is like in extreme pain. They don't want to do a surgery. They're very conservative. How would you go about that? I mean,
So there's some providers that do PRP injections in the spine, typically in some of the smaller joints or the joints in the spine called facet joints. Just like we're speaking of
right.
injecting the knee joint, it's a synovial
Little one
joint.
back there.
Yeah, we have one right back here.
Yes. So
Just so you know, people know that there is an
yeah.
option as well.
Yeah.
So this being the spine, this is the posterior or back. So if you run your fingers up and down the middle of your back, these are the spinous processes that you would feel. This is the front, so you're facing towards the host here. This is the disc. Disc has an outer fibrous region, the annulus fibrosus, a more central gelatinous area. These here are the joints. Facet joints are actually here. So you would do the injections in those areas if they're in
And that's a real common injury when somebody is in either they've had a fall
particularly acutely.
or they've had an accident. Those joints, those little joint capsules can become inflamed and injured. And see them sometimes on MRI is very helpful with seeing what level of damage or injury there is, so we can be more precise with our treatments, which is great. So, how many injections like I know with epidurals, I've heard some doctors say you can only do 3 in a year. Is there a certain number of PRP injections that somebody can do, let's say in a knee joint or a tennis elbow
Sure,
in the
sure.
elbow?
So one of the thoughts with respect to limiting numbers of corticosteroid injections, 3 in a given period of time, 3 to 4 years, because a corticosteroid is a very good and effective anti-inflammatory. It still may be the gold standard, certainly most commonly used. The downside, it is very aggressive and it's also damaging to the tissue. And so it's hard to predict who will, after either one injection or several injections, will realize more of the side effects of tissue injury versus the anti-inflammatory effect. So a lot of providers will limit, particularly epidurals, 3, particularly if it's not helping. With PRP, given that it's your own tissue, there's really no downside. I mean, some discomfort associated with the injection. You can have as many injections as you need to. But we said before, it takes months oftentimes. So it really depends on the severity of the injury, the indication. Typically, maybe every 12 to 15 months or just one time and the patient's fine. But you can have as many as you need.
That's great because with some of these steroid injections, people are afraid. They've come to me and said, I don't want to get any steroid injection because they've heard some bad things about it. So are there, for people out there, are there any patients that are usually, hey, not a candidate for doing PRP? We talked about the benefits of it, but there are people maybe high blood pressure, or what if they take Coumadin, like a blood thinner, and they're a little older?
Right. So I was going to say there are some what we call relative contraindications. So a patient that's on a blood thinner, Coumadin, Xarelto, you would not want to. You can do it, but kind of use caution because they may have a tendency to bleed, bruise a little bit more. Patients that have a low platelet count, so you may have to draw a little bit more. You may want to get actual platelet count beforehand. Certainly, if they have an active infection, cellulitis, something like that in the injection area.
Right. So if there's some people out there and they've maybe tried PRP, some people I've heard say, "Oh, I tried PRP, it didn't work."
Right.
And I'm not a medical doctor. I'm not trained in this, but from a little bit of research I've seen, it's important that the patient follow directions after they get the treatment done. And I know in my own experience, patients sometimes are not as diligent about lifting properly or doing the exercises we prescribe at home for them. And if they maybe took aspirin, or they put ice on the area instead, or they overloaded the tissue too soon, it can. I mean, those are things that could really ruin the outcome. Right. Okay. So very important. If someone does decide to get PRP injections, that they follow the doctor's recommendations. Extremely important because even it takes time to heal, like we talked about. Sometimes patients want things, we all want things like that. Hey, I want to lose 10 pounds in a week.
It's not going to happen.
It ain't going to happen unless we do like a lot of harvesting of adipose tissue, and then maybe I get some stem cell, then we'll talk about in a second, then maybe. But maybe not, I don't know. But we all want things really quickly. And it's important, I think, for people to patients and to follow the directions that providers give to patients. And it's so, I feel so optimistic that there's doctors like yourself that are surgeons and that could very easily say to patients, hey, you need surgery. We're going to do a knee repair. We're going to scope your knee. We're going to do this procedure on your in your elbow. And now you're offering this kind of treatment, which is a
no, it's fantastic. I mean,
yeah,
we can do more like a holistic approach.
Absolutely.
To healing.
I mean, in conjunction with that, I do take a holistic approach. Tend to take a little bit more integrated approach. I've done, I'm sure, well over 5,000 surgeries. I still do surgery. This technology and treatment that we're speaking of, it can be used in conjunction with surgery as part of a continuum of treatment, physical therapy, activity modification, perhaps corticosteroid injection, PRP, surgery. So thinking about it not necessarily as an alternative, but as a continuum and a viable non-surgical option. I treat a lot of patients that have adhesive capsulitis, frozen shoulder, and before, on all of my patients, before I do any type of shoulder procedure, I'll get what's called a hemoglobin A1C. It measures your blood glucose over time. It says, well, why is the surgeon getting a hemoglobin A1C, and like, why does he care? So, number one, again, it measures blood glucose over time. If you have a high hemoglobin A1C, then we know there's a higher rate of infection, prolonged wound healing, a higher rate of adhesive capsulitis, frozen shoulder. So in the case of, you have a 45-year-old woman who's in a motor vehicle accident, she's rear-ended, she has her right hand on the steering wheel, and she hears the screeching of tires, looks in the rearview mirror, and because she's on 95 and bumper-to-bumper traffic, there's nowhere to go, and she gets rear-ended, puts her right hand on the steering wheel, and does physical therapy, not responding particularly well, and then gets the MRI and shows that her shoulder capsule's lighting up, and over time, her shoulder's gotten progressively stiff, adhesive capsulitis.
Right.
And so, but then you also realize she had a hemoglobin of A1C that's elevated, and so I can do PRP with that and have a very good outcome. But also, treating her non-surgically, but we also know that those patients and what affects outcomes are metabolic dysregulation, poor mitochondrial function, reactive oxygen species,
Right.
chronic inflammation, and then tissue injury. So often it's systemic.
So I was going to say, Doc, would you say that what type of patient would not be a candidate for PRP? Would you say
A smoker, heavy smoker,
like
heavy
somebody who has
drinker.
diabetes, like really bad diabetic?
Yeah, I mean, because we're taking their
and
plasma and their
right.
platelets and we're concentrating it. Garbage in, garbage out.
And
Garbage.
I can't make chicken salad out of chicken, chicken dump, whatever you want to call it. I mean, help me, help you.
Yeah.
And like I said, it's not magic.
And possibly, what about if they have a crappy diet? They're eating all fatty
Absolutely.
food. They're eating.
Absolutely.
They're eating.
And I was going to ask you, would you prep a patient beforehand?
Yeah.
Like, listen, let's get on a healthy, clean diet.
Absolutely.
Let's work out. Maybe let's meditate and do some yoga.
Yeah.
Let's get
all
some
of
good,
that
healthy
helps.
mitochondria.
People say, oh, that's hogwash. But you know what? Chronic inflammation, in part, what drives that? Cortisol. If you're constantly in that fight or flight, high adrenaline, high cortisol, we're in this go, 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 go state where we don't sleep. People come to me, and I know you're going to talk about peptides later, perhaps, but some CJC, and they'd say, well, what about growth hormone? I say, well, if you want to have a nice dose, healthy dose of growth hormone, go to bed, get a good night's sleep.
Right.
That's when mom was right.
It's recovery time.
It is.
It's recovery time. We're gonna talk about that in a little while. But I do want to talk about stem cell real quick. And when I first heard, and again, I'm not a medical doctor. I'm a chiropractor, but I think there's a lot misconception. I might have even had it myself. I'm thinking stem cell, the type of stem cell, the pluripotent or the embryonic type tissue. And I was thinking, I heard people getting stem cell injections years ago, and I'm thinking, what are they going to regrow their knee? But I found out later that that's not the case. There's different types of stem cells. So I wanted to talk just briefly about what are stem cell injections. A little bit about that. I know it's also under the regenerative medicine umbrella, and it can help people that are injured or having injuries as well. So let's dive into that just a little bit. We have a little bit of time.
I spoke earlier about how it's typically identified either autogenic stem cells derived from the host and the donor are the same person, or allogenic, a source other than yourself. So we can use bone marrow aspirate BMAC, bone marrow aspirate concentrate, and these are what we call hematopoietic stem cells, meaning they are derived from blood lineage or adipocytes, fat cells. Fat.
I got a lot of
is a
that.
nice sort- we all- a lot of
Recently.
us do. I do as well. Just being transparent.
I'm just trying to get to that weight loss challenge. I know my gym's going to do it soon. I can't wait.
I mean, one of the differences with the bone marrow derived stem cells, they typically age, or you decrease in number as we age, and the effectiveness drops as we age. The fat derived cells, typically that's not the case. And then they have, under a microscope, they have a different appearance, different level of activity,
Morphology.
different growth factors, etc. And then on the allogenic, you have the amniotic fluid derived, placental, umbilical cord. And most of the, particularly the umbilical cord derived cells, typically are growth factors. There's another type of regenerative therapy called exosomes. And these are basically molecules that originate from the stem cell, whether it be bone marrow or fat derived, and then they will release those, same mechanism that platelets do. They release those growth factors there, and the signaling molecules will direct the activity of the cells in the area.
Okay.
Paracrine cells.
I'm following it, but
Like a
for you guys
conductor.
out there, for you guys out there that are listening, stem cells is another effective method that doctors like Dr. Tyrance, orthopedic surgeons, and some other type physicians use as a way of using stuff in your body to help you heal and help you regenerate tissue, or help decrease pain and help increase function and mobility, things like that, decrease inflammation, which is a huge, huge thing. So with the stem cell type of injections as well, do you do both? Do you do PRP injections in, let's say, somebody's tennis elbow, they have tennis elbow, it's a tendon issue. Do you do stem cell in one, or do you do PRP, or do you do them both together?
All of the above, any various combinations. So typically, if it's mild to moderate injury, a partial thickness tear, a tendon strain, grade 1, grade 2 tendon or ligament injury, and there's still regenerative potential and ability, something like PRP or exosomes would be appropriate, because there's still that healing ability in the area. You have to in part understand the level of the injury, what you're seeing on the MRI, the patient's functionality, their expectation. But if there's loss of tissue integrity, say a more severe tear, and you know that by introducing signaling molecules in that area, a conductor doesn't play an instrument, but you know a bad conductor from a poor conductor. A good coach from a coach isn't out there on the football field playing or on the basketball court, but you know a coach that's able to get the most out of his players. That's what the signaling molecules do. They're able to get the most out of the regenerative potential in the area in which they're introduced. So to kind of use the sports analogy.
Okay.
And so if you have a good coach but you don't have the players, then you might need cells. That's when you go ahead and draft some players, the whole NIL, where these colleges are losing all of their players because they're going to a different school, looking for
Transferring
more
every
money.
year, yeah.
So you have to introduce more cells to the area to refurbish and to reestablish continuity.
Right.
Like an athletic program, reestablishing players.
I love
to
it.
Get continuity, you know.
I'm waiting for my NIL money. I'm waiting for it. But this has been amazing. I think that if people are out there and they have been injured, either in a car accident or a sports-related injury, and they are looking for ways that are more natural, because a lot of people are looking for more natural ways of healing, and this could be a great option for someone to investigate. Now, if they are in South Florida or maybe they want to come down here, how could people find out more about you, and how could people come and see you for a consultation evaluation to see if they'd be a candidate for PRP or stem cell injections?
We're located in Delray Beach, Florida, here in Palm Beach County. Our office number is 561-898-0303, and I have a sports medicine practice. I'm on a handful of insurances, cash pay, do personal injury.
Right.
So there's multiple ways. I mean, I've even been known to take some food. That's upset. But yeah, if you can cook, I'll
Okay.
yeah.
Awesome.
Take some food,
Awesome.
too.
Awesome. And we have a little tradition, right, Jen?
We do.
At the end of the podcast, which you've been on before, so you know this. You knew this was going to be coming. We feel that we want to give our guests a kind of a memento of comeback, of resiliency. So we have all these different tumblers with superheroes on them, because to us they represent comeback, resilience, and based upon all these ones we have. I know you picked Thor last time, but which one speaks to you? Is there anyone out there that you like, and why?
Look at Doc. He's like thinking.
Yeah, I'm going to go with Captain America.
Oh, I love
Oh.
it. I love it. You like Captain America? What's about Captain America that
I mean, we
speaks to you?
impart the discipline, the stick-to-itiveness, level of focus. We spoke about a subject that can be relatively controversial, stem cells and regenerative therapy.
Mm-hmm.
So I tried to speak about that with a level of integrity and not give a sales pitch, but really try to educate and inform.
Right.
So,
Well,
Captain America.
in the next show, we're going to get controversial because we're going to talk about peptides. So they'll get a little bit controversial then.
Sure.
But anyway, it's a pleasure having you on as always. I think
Thank you,
you're a doctor that not only is a great clinician, but you have empathy because you've been injured. You know what people go through as being an athlete. And great down-to-earth doctor, cares about the patient, is there and really dedicated to getting their patients well, even if it's not surgery, even if it's another way. So I like that about you, because there's a lot of surgeons out there that they're mainly just focused on that one thing, that surgery. So anyway, thank you very much for coming on
Thank you, Doc,
today.
so much.
We really appreciate it.
For having me.
And again, remember, like, subscribe. See you on the other side. Yes.